Go ahead and welcome you all to the 2021 simulation conference. This has been quite a year, hadn't it? I mean, who would have thought? I'll explain first. My name's Laura Morris, and I'm at the Oklahoma Department of Career Tech. We've been one of the sponsors of the Oklahoma Healthcare Workforce Center's simulation conference for the last, since it began. The Workforce Center is looking like we are probably going to shut it down. And right now I'm the chair. And so a few weeks ago, I got together with our simulation conference from last year, the people, and said, hey, would you be in, do you think we should do something? And we sent a message out and you all replied back and said, yes, please. And so I think today's going to be, obviously, because we're virtual, it's going to be a lot different than the simulation conferences you've been to in the past. But hopefully it'll all still be very relevant, and hopefully it'll be much more casual than we've had in the past. So I really hope that you all enjoy today and get a lot out of it. Now, let me go ahead. I know everyone says this, and it's so annoying when people do, but I'm just annoying. I'm going to, hopefully now I am sharing the agenda. And Susie, is that right? Okay, great. Before we get started, I want to introduce my control. I've got a control panel, and then we have the committee. Susie McCatherine Lauer is, wave Susie, thank you. Susie is our, she's going to be keeping track of the chat. So if you all have questions or thoughts as you're going along, when you hit the chat, hopefully we will, she'll let us know that you all have a question or a comment, and we'll stop and take care of that. If it's something that we need to wait until the end, we'll wait until the end. So let me tell you a little bit about what's going on today. So we have, and you all can see the agenda. We're going to, when we got the committee together, one of the things we talked about was that we haven't done in a while at these conferences was to share a simulation. When I looked through the comments that you all filled out prior to this conference on the SurveyMonkey this last week, I noticed that over half the people here have never been to a simulation conference. And so I'm assuming that also means don't have a lot of experience with simulation. So we are so excited that we have so many newbies here. And so we really decided to try and make this conference where it would be appropriate for the new instructor, and then also someone who's been around for a while. So, and a lot of it is just going to be, we want discussion, because we understand that it has been one heck of a year, and we want to find out, what have you guys been up to? What did you do for simulation? How did it work? Because we understand that we all had to do it, whether you wanted to or not this last year. That's been part of the way that we've been able to achieve clinicals over the past year. So you can see that we're going to go over a simulation that's using telehealth questions. Okay, and then we will take a little break and move into the same patient, but we're going to do an actual simulation, or you will watch an actual simulation. And then we've got these 3 different sessions that we put down, and as we talked on Monday, after reading everyone's questions, we decided we needed to spend our time answering questions. And so we have a wonderful panel here. Nicole Jackson, Josie Scott, Sue Kerr, Sandy Teal, and Dustin Hicks. And I'm pretty sure I've missed other people as well, but they'll pop on too. And I hope that we can have a discussion rather than, it's like discussing within a room full of 80 people. That should be interesting, right? But we're hoping that some of the questions, we've been able to identify some common questions that there were across the board. And so we have been putting those, we put those questions into groups, and we're going to go over those during that 11 to 12 timeframe. So without any further ado, do you have any other questions, or is there anything that I could answer for the group?
I'm sorry, you may have already answered this, but will this be recorded for a later viewing?
Yes, ma'am. It's actually being recorded right now.
Okay, perfect.
And well, I mean, silly me. Yeah, of course it is right now. But yes, we are recording it. And as soon as this is over, we will download it. As soon as we download the link, we'll be sure and send it out. And then we'll also have it posted out with some of our resources that are available. Okay. And so we'll give you the link to that as well. So if you have friends or other colleagues that weren't able to attend, right. I understand, obviously there's people out in clinical that won't get to participate today. So that's what I wanted to check on. Okay, I'm making sure my email that I have everything I need. Okay. And Josie, we're going to get started with your YouTube link. We did a little dry run yesterday, and we are hoping, fingers crossed, that the video sounds okay. Have you guys been on some of these where for some reason videos don't come across Zooms very well, and like you have to adjust all your settings? So like I said, we're hoping we had a good time, because we also discovered yesterday all the little glasses and the little bows in your hair and things that you can use in Zoom. So anyway, okay. So yes.
Well, let's wait until I actually put it into slide 5. So I'll let you know when we're ready for the video.
Oh, great. Well, let me go ahead and I'm going to pull it up real quick, and then I'm going to minimize it, stop the volume and minimize it. Okay.
Okay.
Oops, stop. Stop. Okay. Now I've got it on there and stopped. And so I don't know, can you share your screen?
Let me try. Yes, I can.
Okay, fantastic. So you go ahead, Josie, and you let me know when you're ready.
Can you guys see my screen?
Yes.
Yes, ma'am.
Okay. Okay, so what I'm talking about today is telehealth. Now, I have Tammy Kersey's name on here too, but unfortunately she's out at a clinical site, so she wasn't able to join me, but this was done in collaboration with her program. And this was with her medical assisting program. So basically, when we got shut down in March from classroom and clinical, she was struggling on how do I do stuff with my medical assisting students. So her and I kind of got together and tried to figure out what was going to be the purpose of the simulation, because that's where we had to start. So we wanted to create some virtual simulations for the medical assisting students. And we knew that because of COVID, telehealth now just became the way medicine was going to be done for quite a while, and probably for the future. So we're like, how can we combine that into what we were doing with her medical assisting students? So we also looked at the communication part. As we all know, as we've learned how to teach via Zoom, that it's also very interesting on how to communicate with patients via Zoom or telehealth. So we wanted to add that component into the simulations that we created. So that was part of what we decided before we created the simulations. Then there was the patient teaching through the telehealth, is how are we going to implement this patient teaching for the students? So then we had to put all of that together into creating these telehealth. Now, as you guys all know, we had a lack of time to create a more in-depth sim. So what you're seeing today is a bare minimum simulation, because what we did is we threw things together to get something out there. We do have an NACSL standards that we like to follow. I followed them, but not to the letter of the law that we really would like to, but we still made sure that we had those components that we needed. And that first component would be to identify our objectives. What did we want to do in these simulations? And if you're familiar with medical assisting objectives, they break them out into like your affective domain and your psychomotor domain. So we did the same thing when it came to these simulations. So for their affective domain, what we were going to be looking at is incorporating critical thinking when performing patient assessment and patient care. And that's a little harder when you're just talking telehealth. So we actually added what we call virtual escape rooms. And I'm going to show you those as well as we go on. And then showing awareness of patient concerns related to the procedure being performed. So even though they're doing things virtually, they still had to teach the patient on the procedures that they were doing. And then we went into their psychomotor. That was to instruct and prepare patients for a procedure or treatment. Because even if we were doing telehealth, as you guys know, they may have had their doctor's appointment on telehealth, but they may have still had to come into the clinic to give a urine sample or to get a strep test or to do things like that. So we incorporated that on them having to tell the patient what they were going to have to do. They also had to perform that documentation on their patient information. So we did Google Forms for them to have to document what they were learning about their patient. And I'll show you all of that as we go along. So we also had to differentiate between normal and abnormal test results. That's where our escape rooms come into play. And again, I will be showing you step by step of how we made all of these come to life. And that's the reason we made the objectives first, because that that basically gave us our plan on how to create this. So to use feedback techniques to obtain patient information, including reflection, restatement, clarification. Because as you know, when you're on Zoom, you may not hear things correctly, or if your internet's not working great, it gets cut out and you have to wait and reflect on what the patient said. So all of that was put into play with these Zooms. We actually had some of our standardized patients act like it got stopped. So that way they had to figure out how are they going to deal with this. She wanted to focus on making sure they use their medical terminology correctly and then explaining that medical terminology to their patients. And then coach a patient regarding their treatment plan, what was going to go on with them. So those are the objectives that we put into play to create the simulations. Okay, so then the next step was we needed to do pre-briefing of our standardized patients. We used volunteers from our school because we were all remote. So I just sent out an email to everyone saying, hey, would you guys like to sign up and be a patient for the day via Zoom? It was interesting. We got so many replies. Our bus drivers, our custodians, other secretaries, other teachers, they all volunteered to do this for our students. So I even use some of them even today now that we're back because they had so much fun doing this. So basically when I created the script, and I'm going to show you, I'm going to stop this screen if it'll let me. Oops. Let's see. I had them all pulled up on my computer. Now they all look different. Here we go. Can you see the one that says medical office patient information? Okay, I see a nod. Okay, so what I did is the Google form that the student had to fill out, I actually filled out as the patient. So that was the patient's script. Instead of having to retype a whole bunch of stuff because of that time limit that I had to get this created, I just created in the Google form and typed in the information. Now, because you're going to have Hershey Brown here in the next session, we did this for this patient as well. So you can see how you can go from a telehealth to an inpatient hospital patient. So the patient you're seeing here is the information I gave my standardized patient for Hershey Brown. It gives them their name, their date of birth, their age. We make up a social security number because with medical assisting, they've got to get all that information too. So this is a little bit more than maybe what your nursing students would get when they're talking to them. But you can do this in the same way with them, just change the questions. Their address. So these are all the questions, and I know I'm scrolling pretty fast, and you guys will have access to all of these documents. If they're employed, their employer information, are they a student, their marital status, their contact in case of emergency information, the reason for their visit, was it work related? So you can see all the kinds of questions that these students had to ask their standardized patient. Well, in that pre-briefing, I had to go over this with each standardized patient. We went over their scenario because if we don't go over this with their standardized patient, then they may not give the right information to the student, because the student, once they get this information, that's where they had to take this information and go into an escape room. So that was kind of that information. Let me go back to the PowerPoint. Okay, you should see your PowerPoint again. So once we gave those scripts and then gave them their script to tell the student what to do, we kind of gave them those expectations too, because if the students asked more questions, we wanted to kind of give them an idea of how to answer those. So gave them the background of the patient. And then before the students went into the Zoom to ask these questions to their standardized patient, we did a pre-briefing with those students. So we kind of did this in twofold. First, we introduced the Google Doc that they were going to be using to ask the questions. The reason for that is I wanted them familiar with those questions before walking into that Zoom. So they got that a couple of days in advance. And then the day of, I would basically talk to them about their patient, they're coming in, their appointment time, and then we would use Zoom and use breakout rooms. So basically they would come in, we'd accept them in, and I would send them to like Jane Doe's breakout room. When they got done asking those questions, they would come back to me, and then I would put them in the next breakout room for the next patient. So they did all of this pretty much in a morning session to get their information on their patients. So while they were doing their interviews, they actually were filling out that Google form, just like they would be filling out their chart if they were doing the patient. Once they completed that and submitted their form, then on the back side, they would get that information emailed back to them. So they would have all that information for their virtual escape rooms. Now, if they answered the questions correctly, they should have been able to answer those escape room questions. At the end of the day, that's when the teacher debriefed them on the experience. We could have done a little bit more there, but again, on that time constraint, we basically did as quickly as we could getting this together. So Tammy and I have already talked about how we want to improve this for the next year. Okay. Now the slide, let me go on to the next. Okay, now the YouTube link, Laura.
Okay.
I'll stop share.
Okay, hang on.
It'll
There it is. And oh, I need to start sharing.
Yeah.
Share screen.
So this is a video. This isn't from when we did this during COVID. This is one that I had a student do just this week on this patient that we're going to be talking about, the Hershey Brown.
Okay. You guys tell me if you can hear this or not. Put it in the chat if you can't. She hasn't said anything yet.
Can you make it in the full screen?
Yeah. Oh, sorry, that's silly.
Need more volume.
Okay. She's super quiet and I have a hard time. It's up 100% on my end. I'll keep trying though.
What is your name?
My last name is Brown. My first name is Mercy.
Okay, this should be loud.
I'm sorry, can you repeat your first?
Is that better?
Hersey, H-E-R.
Yes.
S-H-E-Y.
Yes.
Your date of birth? Starting with the month.
Starting with the month 4. The first day, 1986.
Your age?
35.
Your social security number?
Yes, 1, 2, 3, 4, 5, 5, 6, 5, 4, 1.
Your street address?
1720 Spring Lake Drive, Oklahoma City, Oklahoma, 73111.
Your home, or cell phone number?
405 999 5416.
Occupation?
Student,
Employer?
none.
Employer? Your marital status?
Single,
Your contact in case of an emergency?
it would be Michelle Brown.
Your relationship?
Is my mother.
Your home or cell phone number?
405 999 2000.
Work phone number?
405 595 4654.
Reason for your visit?
I must say I need to get a spot checked out on my foot.
Is it a work-related injury?
No, ma'am.
The date of the injury?
Oh, I don't remember.
The month?
Well, it's just a spot. I didn't have no injury.
Um, Insurance company.
Health choice.
Driver's name.
Michelle Brown, my mother.
Policy number.
1, 2, 3, 4, 5.
Group number.
123.
And we have any of the following. Legal. Mom. Moving cost.
Yes.
Moving cost.
No.
Burn diseases.
No.
Diphtheria.
No.
Pneumonia.
No.
Pneumonia. Fever.
No.
Stroke.
No.
Hepatitis.
No.
Heart disease.
No.
Arthritis.
No.
Transmitted disease.
What did she ask, Josie?
Infection from disease.
A sexually transmitted disease.
Oh, STDs, gotcha.
No.
Bladder infection.
No.
Hepatitis C.
No.
Migraine headache.
Mm-mm.
Tuberculosis.
Mm-mm.
Ulcers.
No.
Kidney disease.
Nope.
Diabetes.
Nope.
Cancer.
Fever.
Polio.
No.
Glaucoma.
No.
Hernia.
No.
Blood or plasma transfusion.
Oh, no.
Back trouble.
Nope.
High blood pressure.
Nope.
Thyroid disease.
No.
Bleeding tendencies.
Nope.
Hemorrhoids.
Oh, heavens, no.
Asthma.
Nope.
Allergies.
Nope.
Eczema.
Mm-mm.
HIV,
Nope.
infection, infectious mono,
Nope.
bronchitis, mitral valve,
Nope.
have you had any surgery? Have you ever prescribed any other autonomous systems?
Yes.
Okay.
Simvastatin, 4 milligrams once a day.
Any allergies?
No.
Do you have any serious accidents?
Not that I know of.
Okay. That'll be all.
Is it? Okay.
Thank you.
No, thank you.
Okay, so you probably go ahead and stop the video because
Okay.
it's just going to be me coming back and stopping it. So as
Okay.
you can tell with that video is what you can do with that just in that little scenario as she's going through all those disease processes, since they have the exact same form that they're filling out, you could actually put beside like the mitral valve prolapse and say, what is that? and making the student ask those kinds of, the patient ask those questions to the student to see if they know what those are. So this was just a quick run through because of us trying to match the scenario that's going to be done next. But I think it kind of gives you idea of how much more you could actually do with that. So let's kind of go back to the PowerPoint. So one of the other things is now the Google form that she had to fill out was, let me see if I can find that one on my computer.
Are you guys able to see Josie's PowerPoint?
Okay.
Okay.
So
Not now, but
okay, you should be able to see a Google form now that says medical office
yes.
information.
Yes.
So this is what she was filling out, why she was talking to them. So I'm just going to kind of scroll through it. It's the same information that was on the patient script because all I did is fill this out and gave it to them. And then I wrote little notes on it for him to, like on the medicine, I said, only give one thing at a time. So that way, just give the medicine name and see if she asks the dosage. So all of this is already there that she just has to fill out. And I have this in a shared folder. So anybody that's interested, I can send you this link or send you the PowerPoint that will go straight to this folder. So then it talks about their reason for their visit, their insurance information, their patient history. And this is the line that I'm talking about. You could have little notes there making the patient say, what is that? Or as you notice when she did the sexually transmitted disease, he knew she was going to ask that because it was on that sheet and she kind of whispered it. So he just kind of ignored her. So how does the student handle that? That would be important to be evaluating as well on the students. Then there's surgical history and things like that. So that's the Google form that the student was filling out. Okay. Go back to my PowerPoint. All right, the scenarios that we created for medical assisting, these are the ones that we did. Goldie Hamburg, she came in complaining of blood in her stool, so they would have to do a hemoccult test. And the escape rooms are what did these tests. And I'm going to show you exactly what I'm talking about on those escape rooms and give you that example. So on Jane Doe, she had a UTI, so we did a urine dipstick. On Pete Harm, he had a UTI, but he was also diabetic. So what's the difference between somebody that's not diabetic and somebody that is on the urine dipstick? So we showed that. Brett Mason with ketones in his urine because he's diabetic and his hemoglobin A1C. Roxy Wilburn, the sore throat with a strep test. Rox Onley, he had a fracture. So we added another component to his is not only did they have to go and ask these questions, then the next room they go into, they had to teach him how to use crutches by using whatever they had in the home to teach him how to use crutches. They had to think outside that box and figure out how would you teach somebody at home how to use crutches. And then of course we had Kelsey Johnson that had the pregnancy test. And I will get all of these so you guys have access to these if you would want them. So now the escape rooms. I did create one for Hershey Brown to give you an idea how you can do that just for that. Let me share that. Okay. So on the PowerPoint, and I just took it down, I know, but it told you what the answer keys were for that lock. So you would put you guys can see my escape room, right? Okay. So you would put your name, and I'm just going to put a couple of letters. So the first question was, what is your patient's age? So if they were listening correctly and documented it correctly, they have that key. So the key, he was 35. Whoops, wrong spot. He was 35. So it's going to take them to their next page. Then they need that patient history to fill out the rest of this. It's what medical history does your patient state that he has had? If they documented it correctly, it would be his chicken pox. For his patient insurance, he had health choice. Was this a work-related injury? No, it was not. So the key is the 2, the 3, and the 2 for that code. So then it goes into, and because all we had was that part of the simulation, Now it goes into, is the patient single, married, divorced? We're single. Occupation was student. The emergency contact was his mother. So that code's going to be a 1, a 2, and a 3. So when they submit that, they now get this. Congratulations, you have escaped. Your patient is being admitted into the hospital for treatment of his wound. And this is going to take him straight into that next simulation that you'll get with the next presentation. Now, that is the one I did really quickly with the Hershey Brown. Now, you're wondering about the UTIs. So let's pull that one up. Okay.
So this is what you do virtual. This is not what you do in the classroom.
Correct. This is what we created because of having to do it all virtual.
Nice.
Now, if I can find my other Google form. Give me just a second. It's not wanting to pop up. You think you get everything ready to go and then it's not. Okay. That's not the screen. There it is. Okay. So this one is our Jane Doe. You guys can see Jane Doe at the top, right? Okay.
Yeah.
So this one, you'd have to have the unlocks that's on the PowerPoint screen. So again, they have to put their name in so we know what student it was. So here I'm asking, what is the allergy? Okay. Now the allergy is sulfa. So if they spelt it with a capital S, it's going to give them a little clue, all lowercase. So that way you can have those little clues built in for them to answer those questions. So then the next, okay, let me refresh.
So if the spelling wasn't correct, it won't let you in either.
Right.
Okay.
So then I did lowercase and then it lets me in. So Jane Doe, if you, on that patient, like I said, it was UTI. She was complaining of having trouble going to the bathroom. So we're going to hit UA. It's going to go next. So then they're going to have to type in, how would you explain to a patient how to get a clean catch urine? So this is going into, what did they learn? Right step to step, how you would do a dipstick urine test. So now they're going to have to explain that. And then it kind of gives us that urinalysis dipstick guide. So what we're all familiar with, it kind of gets them familiar, but then now our questions are, what is the reading time for white blood cells? Okay, so they'd have to go up here and figure that out. Not only that, it says 2 minutes. So now we got to convert it to seconds. So it's also kind of making them do some of that math. Okay, for acid base reading, it's going to be the 60 seconds. And I'm not, I mean, I can go back and forth, but I think you guys kind of get the idea. So I'm just going to kind of put the answers in. So kind of like the sugar, they need to know that sugar and glucose is the same thing. So it's kind of making them realize what verbiage are we using here. So that's 30 seconds. And then on the ketones, it's 40. So those numbers are going to be 1, 3, 2, and 1. And it's going to go to next. Okay.
So Josie, if it doesn't, then they go back up to, does it say which one they got wrong?
No, they'll have to figure it out.
So you have to keep going back and answering until you get the right code at the bottom.
Correct.
Cool.
So then on this one, I actually was able to take a picture. I created a picture. So now here is the dipstick alongside their readings. And then what color are we dealing with? Okay. So that way they actually had to read that urinalysis. Okay. So on this one, I'm just going to kind of go through it quickly. We had the large, which I think I did halfway decent. I'm trying to get the colors to be exact. And then our nitrite reading was positive. Our bilirubin was a 0.2. And I'm cheating because I have the other screen up that has my lock number. So, and then our protein was trace. Our pH was 7.5. Blood was a moderate reading. We were negative on ketones on her. our specific gravity was 1.010. And then we were negative on glucose. So then we would type in that 9-digit number. And that's the reason I put here 9 digits, so they know they had to have all of that. Okay. So then what is the interpretation of the urine dipsticks? Not only did they have to write that down, and now they have to interpret it. What did it come across? Does she have a UTI? Does she not? What's the answer to that? And then the last one is, what is my patient's age? That goes back to their video or their telehealth questions. So we're 40. And then once I click that, it would say, congratulations, you've escaped room 1. So that's how we kind of did those virtual escape rooms. And I have one for each one of those. Okay, let's go back to my PowerPoint.
And many of you have been asking, how do we get the information that Josie's saying she'll share? We have a place at a website, ctu.org. And we will, is that right? .org, yes. And we will explain how to get into all of that at the end of the meeting.
And then I'll also post the PowerPoint so you have your locks on here as well. Okay.
Josie, someone else had a, did you get your question answered? Hang on, I'm looking for the chat. Sorry, go ahead.
Wrong, then they have
Yeah, what do you do if you get it wrong? Yeah.
just have to keep trying until I get it correct. So yeah, they can just keep trying on that same one. Debriefing of the students, even the one that I just had to do it for an example, so you guys would have a video of it. She's like, oh man, I really like this. She goes, I wish we'd done more of these this year, because she goes, I learned that I need to be more proactive in asking the questions. I need to pull out more information. I can't just ask the questions. I've got to be prepared to be able to ask them what the wind looks like and things like that. So she even identified, just doing this as an example for me, how much more information she really needed to get. So, and a lot of them said that, get deeper into the full picture, get more specific answers. They wanted, several of them said we needed to document more accurately, because when they went to the escape rooms, they may not have had all the information they needed because they didn't think it was as important. The patient teaching was harder than it was in person, because they're having to make sure that the person understands a different way. And then communicating the right terms or words when giving instructions. So those are just those quick things that those students learned by doing this, that we threw together March and April of last year. So
Josie, can I stop you for one question? Oh, go ahead.
yes, what I was getting ready to do. Do they have to start from the beginning again, or in the current section? It should just be the current section when they go back and put that in. I noticed if you use words, it's a little bit more tricky than if you use numbers.
You're saying the Google Docs.
Yes.
Okay. And did the students evaluate themselves? Because immediately I'm like, oh, that girl needs to speak up and not be so tentative. And so I just wondered, is there a grading process that goes along with it, or does she evaluate herself? Or
In this, because we put it together so quickly, we just kind of let them evaluate themselves. And actually, we didn't do any recording when we did it originally, which after this sem doing this with her, having her record, I'm like, I wish we had recorded all those students, because they may have learned that they didn't talk loud enough. But that was one thing that I did have the standardized patients. After they were done, they got to spend a few minutes to tell the student what they wish they could have done differently. So I did have those standardized patients talk to them about their communication. Now, with that said, this was just telehealth. We did this year in our day PN program, we had them do the older adult interview this way. I got a lot of volunteers that were 55 and older and did it via Zoom with them on doing those interviews to get those students used to at the beginning of the program. So there's all different ways that you could actually utilize this in doing that. And I'm going to go ahead and stop the share. I think that's.
Another question was, did you have the student complete the escape room individually? So.
Because they were at home at this point. So yes, they were all in their own homes doing this remotely. So I think if they ran into problems, they called each other and asked questions. We couldn't control that real well. But yeah, the goal was for them to do it individually. So.
Y'all are welcome to unmute yourself if you want to ask Josie any questions.
I'm good.
So did you say, Josie, that you actually had these interviews done by the students by Zoom links?
Yes, we actually put them in, we opened up Zoom and then put them in breakout rooms with that patient. So that
Okay.
patient stayed in that breakout room and we just moved the students around.
Okay.
Any other questions? This would be awesome for case studies for the next gen NCLEX. Has anyone created some case studies or do we need to do our own? Shoshana Rose.
We can use these as case studies if you want to use them. There's a lot of different scenarios out there, especially in the resources that we're going to share this afternoon.
I don't know, but this is really cool. I had just seen the video. I hadn't seen your PowerPoint and I love this. And I'm so glad it's going to be out there because I don't know that there's a lot of medical assisting teachers on this session, but they will, wow, they will love this information too. I mean, it's really cool.
Yes, thank you so much for sharing. This is wonderful. I'm excited to share it with the medical assisting program. I think it's going to be great. Thank you so much.
I mean, and it works for nursing too, because we got a lot of nurses that have to do the telehealth. We would just have to change the questions on the Google form a little bit because they don't ask so much about the insurance and stuff like that. But I mean, it works for all.
So Kayla has the question, is the Google Doc something that can be edited and saved as they see fit?
What I've done is I have put those in a shared folder. What I would ask is when you open it, just make a copy of it and then you can do whatever you want with it. Try not to change the one in the folder so that way everybody starts with the baseline. But yes, you're more than welcome to take them, make copies and tweak them however you would like. Only catch would be, I would love you to put them back in the folder so we can all use them too.
Any other thoughts, questions?
Does Google Docs allow the format for you to create those escape rooms? Is that built into Google Docs or is that something else you worked with to create that?
No, it was purely Google Docs. It was the response validation part of the Google Docs. And if you get with me, I would love to show you how I did that. And actually, if you open up the Google Docs and click on that question, you'll be able to see how it was set up. So you could set up more. That's pretty much how I did it, is somebody else had created one. I belong to that nursing transitions on Facebook and a lot of people shared stuff. So I opened one of theirs and went, oh, I can do this too. And went from there.
Okay, well, Josie will be with us all day. So if you think of something else, you can message her privately or you can just put it in the chat. We're running a little bit ahead of schedule. Woo, love that. So just so in the sake of everyone getting to eat lunch when they want to eat lunch today and not at 2 p.m., let's go ahead and take a short break now. And I've got 9:50. So if you all think you can make it a 10-minute break instead of 15, let's come back at 10 a.m. and we will start our second presentation.
And Laura, I still need, if they want a certificate, I still have a few, about 10 people or so that haven't put in email addresses and their names.
Okay, if you want a certificate of participation for today, we need you to put your name and your email in the chat.
Hey, Laura. if
Yeah.
you Stop recording and then start it back up, then you can have each session recorded versus having one large